It is 5:07. Now, there are calls for the state government to better investigate the reasons why there is such a high stillbirth rate in Western Australia. The Health Minister, Roger Cook, says that this rate, while it hasn't changed in 2 decades, no one really knows why. There was a federal inquiry that found pre-birth deaths for babies who died after 26 weeks gestation remained largely explained. Let's first up go to Carrington Shepherd, who's a researcher with the Telethon Kids Institute. Carrington, good afternoon.
Good afternoon, Barry.
What do we know about the rate of stillbirth in this state?
Well, we've been doing some work on this recently, some preliminary work, and we generally see that the figure is about 7 per 1,000 births that go past 20 weeks gestation. So this is a figure that hasn't really changed much over time. It depends how you look at the data, but overall, I mean, the rate and burden of stillbirth is often misunderstood. You sometimes quote these figures, and people are quite surprised in Australia that the rate is so high. I mean, we've shown that certainly in WA, the number of stillbirths that we get is 3 times higher than neonatal deaths and twice as high as infant deaths. So that surprises a lot of people. And I mean, despite the scale of the problem here, it's really not seen as prominent a public health issue as neonatal and infant deaths. And I think we need to explore this.
And what can you tell us about the way that the causes of stillbirths are investigated?
Yeah, well, you touched on this. I mean, many of the stillbirth causes remain unexplained, and sometimes it differs based on the jurisdiction, and it differs based on the country that you look at. But some jurisdictions talk about 3/4 of stillbirths being unexplained. We investigate them in a variety of ways. It does depend on the jurisdiction, but there's certainly perinatal mortality committees, which are really important processes that are up and going in most states and territories, and they look at stillbirths and the causes on a case-by-case basis. This is a really important process. There's also, as well, clinical research studies that look at specific issues such as why is the placenta not functioning correctly, how has that impacted on stillbirth, and then there's the sort of work that myself and my colleagues in the West Australian Perinatal Epidemiology Group look at. This is more population-based studies where we can look at the whole picture of stillbirths and examine the data in a different way. So collectively, it's done in a number of ways, how we look at the risks and causes. Part of the problem is that often these processes are done in isolation, and the information that's gleaned from one process isn't always shared. So this is a big limitation, particularly in the work that I do.
What needs to happen, do you think?
I think a range of things need to happen if we want to sort of increase the evidence based on what the causes of these stillbirths and early life deaths are. So the end-level goal for us is really providing insights to practitioners and policymakers. That's our goal here, so that they can make good decisions about how we can prevent some of these deaths. And we know that many of these stillbirth deaths are preventable. This is really important to recognise. But we're also trying to provide support to advocacy groups and parent organisations so they can seek a bigger focus on post-mortem examination. So that's part of the issue here. I think we need to improve what we do in terms of post-mortem examination, improve those processes, but also improve how that information is shared to other researchers so we can get a bigger picture of these causes.
When it comes to knowing the numbers here, are all cases where children are stillborn, are they all registered with births, deaths and marriages?
Yes, what happens in Western Australia, once again this differs around the world, but in Western Australia and most other states and territories, we systematically record stillbirths for all births that go beyond 20 weeks gestation and above. So we actually go back further in time in terms of our systematic recording than many other countries who often focus on 28 weeks and above or 24 weeks gestation and above. So it is systematically recorded. We just don't always have the full amount of information that we need to examine the causes. So certainly they're recorded as deaths. We don't always know about the antecedents of that death or what happened preconception, during pregnancy and around birth and during labour to help us to understand and investigate these in detail.
Okay, that's Carrington Shepherd. Thank you for that, Carrington. Let's have a chat with Laura Sheehan, the mum of 4 children, including her son Beau, who was stillborn in 2014. Laura, thank you for being with us this afternoon.
No, thank you for having me, Barry.
What's your reaction to this push to start a conversation about stillbirth in Western Australia, stillborns?
Oh, I'm massively relieved, to be honest. I mean, this is a conversation that it's been coming for such a long time, and it's going to give so much support to mothers and families that have lost their babies.
In your case with Bo, if as I understand it, you were never really given a reason as to why or how he died.
Yes.
What peace of mind would have that? What would have it done for you if you'd had that information?
It would have helped me in my grief and helped to remove the sense of guilt that I carried as not just a mother but as a woman, in the feeling that I couldn't hold on to him and I couldn't carry him to full term. And with no answers, you feel like that's entirely your fault when really it isn't.
Can you tell us what happened with Bo?
Well, with Bo, there was a multitude of very small things that were different with him to other babies, but they wouldn't have actually accumulated to him passing. It was just one of those things. There was no knot in the cord, there was no strangulation, and there was nothing definitively wrong with him that would have given any reason as to why he passed.
My guest this afternoon, Laura Sheehan, who's a mum of 4 children, including Bo, who was stillborn in 2014. We're talking about this afternoon. There is a push for the state government to look at the state's high number of stillborn children. Laura, you've said that doctors, gynecologists and even radiologists should be more thorough when they're conducting scans. What would you like to see?
I'd like to see extra scans during gestation. I mean, even until you lose a baby and you're considered high risk, that then you're given the opportunity to have further scans and further monitoring. I understand that it's a costing issue. I understand that there's not enough research behind ultrasound to warrant more scans. But for peace of mind for mothers, for peace of mind for specialists knowing that they're accountable, why would you not encourage this? Why would you not encourage further monitoring to make sure our babies arrive safely? And
the effect of losing Bo, what has it been on you and your family?
Oh, it's been profound, Barry. It's an ongoing grief. I mean, you never really get over losing a child, but I mean, I have to say we're stronger as a family because of our Bo. But I mean, he's always in our hearts, and I mean, my children know about their brother, and they always will.
Laura, thank you. I appreciate you coming on and telling your story. And that is Laura Sheehan this afternoon. It's a 5:15 here on ABC Radio WA. And don't forget, if you do need support, or if the issue we've been talking about is distressing, there is a number you can ring. The organisation is called SANS. The number is 1300 072 637. That is 1300 072 637. That's a specialist organisation offering support to people affected by miscarriage, stillbirths and newborn deaths. You can ring them from anywhere in Australia. It is 5:15.
You're with Barry Nicholls on ABC Radio WA.